Good morning, everyone, and thank you for being here today. We're going to dive into a very important and timely topic, understanding and addressing alcohol misuse and abuse. Throughout this presentation, we'll explore the underlying causes, the serious consequences, and most importantly, effective strategies for prevention and treatment. I'm looking forward to sharing insights that can help us better tackle this critical issue together. When we talk about alcohol misuse, we're referring to drinking behaviors that can lead to harm or put someone at risk. This might include binge drinking or having alcohol while doing something dangerous, like driving. Importantly, alcohol misuse doesn't always mean a person is dependent on alcohol. On the other hand, alcohol abuse is a more serious issue. It involves a pattern of drinking that causes significant problems in a person's life, leading to distress or impairment. Here, the individual struggles to control their drinking even when it results in negative consequences. This level of drinking may meet the criteria for what we call alcohol use disorder, which is a diagnosable condition. Understanding these differences helps us better identify the severity and impact of someone's drinking habits. When we look at the causes and risk factors for alcohol misuse, it's important to consider a combination of genetic and environmental influences. For example, if someone has a genetic predisposition, they're naturally more likely to develop problematic drinking habits. On top of that, their environment, like growing up in a family with a history of alcohol use or facing peer pressure, can further increase that risk. Another major factor involves mental health and stress. Many people who struggle with alcohol misuse also deal with conditions like depression or anxiety. Stressful life events or past trauma can act as triggers, making it harder for them to control their drinking or worsening existing problems. Lastly, the social context and how accessible alcohol is are crucial elements. The cultural norms and attitudes around drinking shape how people behave when it comes to alcohol. Starting to drink at an early age can significantly raise the chances of developing misuse later on. And of course, if alcohol is easy to get, that accessibility can contribute directly to higher rates of problematic use. When we look at signs of alcohol misuse, we're talking about patterns like drinking more than planned on occasion or drinking for longer periods than intended. People might also find themselves using alcohol in risky situations, like driving, which is dangerous. Another common sign is trying to cut down but not succeeding, and sometimes experiencing memory lapses or blackouts after drinking. On the other hand, alcohol abuse involves more severe consequences. This includes continuing to drink even when it causes problems with friends, family, or legal issues. People may also go through withdrawal symptoms when they stop drinking, which shows physical dependence. There's often neglect of responsibilities, whether at work, school, or home. Another key indicator is increased tolerance, meaning they need more alcohol to feel the same effects they used to get with less. These differences help us understand how misuse can lead into abuse and highlight when intervention might be necessary. When we talk about the health consequences of alcohol misuse, it's important to recognize the serious damage it can cause. Alcohol can lead to liver problems like fatty liver, hepatitis, and even cirrhosis, which is a severe scarring of the liver. It also increases the risk of cancers, particularly those affecting the mouth, throat, and liver. On top of that, alcohol misuse can contribute to cardiovascular issues such as high blood pressure. Mental health takes a hit too, with alcohol often worsening conditions like depression and anxiety. Plus, because alcohol impairs judgment, it significantly raises the risk of accidents and injuries. The social consequences are just as concerning. Misuse of alcohol can put a real strain on personal relationships, sometimes even leading to breakups or family conflicts. People struggling with alcohol problems might find themselves socially isolated or facing stigma, which can make recovery even harder. Then, there are economic and legal challenges. Alcohol misuse can cause problems at work, including job loss, which adds financial stress. This can create a vicious cycle as financial difficulties increase. Legal issues may arise as well, including arrests related to alcohol use, which compound the challenges faced by individuals and their families. Together, these health and social consequences paint a clear picture of why addressing alcohol misuse is so critical. When it comes to preventing and treating alcohol misuse and abuse, there are several important strategies to consider. First, prevention focuses on education about the risks of drinking, teaching healthy ways to manage stress, and providing strong community support and early intervention programs. Policies also play a key role, such as setting age limits and using taxation to reduce access. On the treatment side, behavioral therapies are highly effective. Techniques like cognitive behavioral therapy and motivational interviewing help individuals change their drinking behaviors. Support groups, including Alcoholics Anonymous, offer a valuable network of encouragement and accountability. Medical treatments are essential for many, starting with detoxification and medications like naltrexone to manage cravings. It's also important to address any co-occurring mental health issues with integrated care. Lastly, long-term follow-up and relapse prevention are critical to maintaining recovery over time. Together, these approaches provide a comprehensive framework to support individuals struggling with alcohol misuse. To wrap up, it's important to understand the key difference between alcohol misuse and abuse. Misuse may involve risky or harmful drinking patterns, but abuse usually has a more severe impact on one's life and well-being. We also need to be aware of the main risk factors that can contribute to alcohol problems, such as genetics, environmental influences, and underlying mental health issues. Recognizing the early signs of these problems is crucial because catching them early can stop the situation from getting worse. The consequences of alcohol misuse and abuse affect not just health, but also social aspects of life, making prevention vital. Finally, if you or someone you know shows signs of alcohol misuse or abuse, don't hesitate to seek help. By promoting awareness and encouraging responsible drinking habits, we can make a real difference.